take a look at the 12 tissue salts. And of course, we're going to start with the 3 calcium family salts. Now, before we get into that, let's just get the big picture of calcium. So we know as mineral balancing practitioners using serial hair mineral analysis, we see a lot of calcium dysregulation. And these are very serious patterns when we see a calcium shell. That will be the death of us if we don't understand how to reduce the shell. We also know that the 4 low is also a calcium dysregulation pattern. That's where the calcium is very low. So on one extreme, we have the high calcium. On the other extreme, we have the very low calcium. So we know that calcium has to be modulated and regulated because in the end, it will get us all. And we call that calcium deposition diseases. So we must know how to regulate calcium in the body. Now, as we look at the function of calcium in the body, it's needed for all excitable tissues, such as neurons, heart cells, muscle cells, smooth muscles. So any type of muscle contraction, calcium is going to be the impetus to cause the contraction. To release hormones such as insulin, calcium is the impetus that releases the insulin from the pancreas. All these neurotransmitters that are hanging out in the neuron, such as dopamine, acetylcholine, serotonin, adrenaline, etc., to release that neurotransmitter, the action potential when it hits the threshold will open up all the calcium gated channels. When the calcium floods in, the calcium will untether the vesicle that hangs out near the end of a neuron, and that will release, that will break the vesicle open to release the neurotransmitter. And then that neurotransmitter may affect another nerve or an end organ. So calcium is responsible for all excitable tissues in the body. So this is why in cardiology, when you have hypertension, they will prescribe a calcium channel blocker to slow down the calcium to prevent overexcited contractions in the body to reduce the blood pressure. So calcium is a major player. So it's not just our bones and teeth. That's where most of the calcium is stored. But the ionic calcium, that's the charged calcium, that's what we have to really be concerned about, because that will have a huge effect. If it's too much ionic calcium flooding about, then that's going to decrease cell permeability. If it's too much, it's going to increase cell permeability. Cell permeability means what's coming in, what's coming out. And there has to be a homeostatic balance, because if that calcium stays in the cell, then that will be the death of the cell. That will be the calcification of the cell. And that's why calcium has always been associated with Saturn, because Saturn is the planet of death and darkness and aging and father time. So calcium will get us all in the end. So how do we modulate calcium in the body is how we start to understand calcium metabolism. And so this is why calcium is such a big player in many functions. Calcium is actually a messenger molecule. When we think of it, we know it's a second messenger molecule, but it's also is a messenger molecule that we're just starting to understand how it's communicating within the cell. And I like to think of that communication like the rings around Saturn. Those are the satellites communicating to the trans-Sagittarian planets of our outer solar system, Uranus, Neptune, Pluto, and then it's communicating with all the planets and stars within our solar system. So that Saturn energy, those rings around Saturn, that solar system has a lot of signaling, a lot of communication, just as calcium in our body is communicating with neurons, communicating with muscle fibers, with cardiac fibers, smooth muscle fibers. So calcium is a major player. It's a player for all our connective tissues. And when we think connective tissues can be hard like bone. They can be moderately hard like cartilaginous stuff like the disc between our spine, or the menisci in our knee, or the pubic symphysis in the sacrum coccyx. So we also have a more fluid-like connective tissues, and that's giving the elasticity to the blood vessels like arteries and veins. So calcium has so many functions in the body that influences cell permeability, influences how muscles fire, heart fires, nerves fire, and all that type of stuff. So we want to have a good understanding of calcium. When we see these patterns that are a shell pattern, we know when someone's in a calcium shell, that's the great calcification. The calcification will get us all in the end. Now, where that calcium deposits, we know it's not depositing into the bones and into the teeth, it's depositing into the soft tissues. And that can be the deposition diseases that are causing our arteriosclerosis, atherosclerosis, preventing the blood from flowing as smoothly as we would like. Those deposition diseases can be into the joints, causing our arthritic type of conditions, from the garden variety rheumatoid arthritis to your osteoarthritis, and all your deposition diseases, your kidney stones, your gallstones. We can have depositions of the salivary stones, preventing it from flowing, can be in the tear ducts, can be in the air canals where the bony architect and the bones that have to vibrate, they start to calcify. All our glands, the pineal gland has these calcium crystals that have to vibrate. And so calcium deposition disease can calcify pineal glands, the thymus gland, the thyroid gland, any soft tissue. We can get calcium deposits in the muscles, our fibromyalgias. We can get the sclerodermas in the skin. So calcium is a big player in understanding the energy of calcium, understanding from a hair analysis how we can start to see these patterns and how we can help to regulate calcium as we're using mineral balancing. Now we have to understand how we can use these tissue salts to help exalt our practice, whether we're just trying to move the needle of decreasing a calcium shell, or using it to help get someone out of a 4 low, or to help dealing with the thyroid calcium potassium sympathetic dominant patterns, how to get balance into these ratios, whether it's the calcium magnesium blood sugar ratio or the thyroid ratio. We have to understand how we can use these beautiful tissue salts to help influence calcium homeostasis in the body. And we know calcium homeostasis is tightly regulated. It's got the hormonal aspect to it, regulated via the hormone calcitonin, the parathyroid hormone, vitamin D. Also, the kidneys will be a player, the liver will be a player, the adrenals will be a player. So many aspects of calcium homeostasis. But our goal when we look at the hair analysis and we see these patterns, how do we help influence it as we come in with the crude minerals of calcium, magnesium, zinc, selenium, iodine, etc. Now we're going to use the tissue salts to help move the needle so we can get better results. We can deal with acute situations, chronic situations, and just add intelligence into calcium metabolism. So let's take a look at these tissue salts. Calc fluor, calcium fluoride. Now, what happens with calcium fluoride, we take the carbonate of lime, which is just an old term for calcium carbonate, and that's titrated with fluoric acid, a very toxic element. Those two combine together in the test tube, and the CO2 is released as a gas, and what you're left with is calcium fluoride. Now, calcium fluoride is naturally occurring in nature. It's found in the enamel of your teeth. It's found in the periosteum of the bones. It's found in the joint cartilages in our body. It's found in a lot of elastic tissues of the body. So it's a big player. It doesn't have a lot of metabolic activity, but it certainly has a lot of structural components to it in our bones, teeth, and the elastic tissues. Those elastic tissues, when we think of these connective tissues, it may be tendons, ligaments, fibers, veins, disc, joints, all that type of stuff. So the calcium fluoride, when we want to prescribe this remedy, now we're not just looking at the hair analysis, seeing low calcium or high calcium, we're putting that together, what is going on with the patient. So if the patient is presenting with a lot of deposition diseases, we may see that as, maybe anything from bunions to the Herberdine nodes on the fingers, to the calcification of the spine, in which we have degenerative joint disease, rheumatoid arthritis, all the bone deformities, whether it's the flat feet, the knock knee, the pigeon toes, the scoliosis, the kyphosis, the dowager's hump, and all these bone diseases. So when we see children developing maybe a forward head carriage, or maybe a scoliosis or a kyphosis or an exaggerated lordosis, we need to give some resiliency to the structural elements of calcium and its effect on the bones and the connective tissues and all these elastic fibers. So calcium fluoride is great when we see either very lax ligaments, where the ligaments are very lax, where you can bend them from here to eternity, and there's no strength and resiliency in them. So they're just very loose, but they don't have the strength. This is where calcium fluoride may be wonderful for that. Then we also have the deposits, whether it's the bunions or the Herberdine's nodes, or the deformities of the spine, to help break down those deformities or those buildup of calcium deposits. We can use calcium fluoride. We may have dental fluorosis. We may have poor dentition. We may have, cavities on top of cavities where the dental enamel is weak. And so we can use calcium fluoride to help strengthen that. Now, just generally speaking, we've all been poisoned with fluoride. And the fluoride they're using is sodium fluoride, not calcium fluoride. Sodium fluoride is a byproduct from the titans of industry that, instead of taking that toxic waste material and disposing it properly, what do? They resell it back to us and dump it into our water, into our toothpaste. So we'll see a lot of dental fluorosis with a lot of also excess bone deformity. So we'll see the dental fluorosis, but we'll also see the bone deformities. And again, that calcification may be in the pineal gland, may be in the bones, may be in the joints, may be somewhere in the body. So when we see the lax ligaments, let's think calcium fluoride. When we see the hemorrhoids, the stretch marks, the varicosities, think calcium fluoride. When we see a lot of the bony deposits, we're going to start thinking calcium fluoride. So this is a great remedy to help build up the elastic tissues of the body, and how it presents itself. We look at the symptoms of the patient, looking at a hair analysis, and that will help us determine how we can prescribe these tissue salts while we're doing mineral balancing, while we're doing detoxification, while we're working on lifestyle changes and diet modifications, because our goal isn't to look for a home run magic bullet. We're working on building up our health using all the available tools for us, whether it's the crude minerals that we're taking based on a hair analysis, how it's prescribed, whether it's the homeopathic remedies to help deal with an aggravation, to help deal with retracing, to help deal with any chronic thing, and how we can add intelligence into the mineral matrix, and especially with calcium metabolism. So calcium fluoride is a great remedy in when we combine calcium fluoride with other tissue salts. It is a huge player, especially when we're dealing with the bony stuff in the body. So now we're going to move on to the next tissue salt, number 2. Number 2, calcium phosphate. Now, the first thing we think about with calcium phosphate, 60% of your bones is calcium phosphate. So this is an amazing remedy because it's a constituent of all cells. It regulates and stimulates the production of healthy cells. It's a restorative tonic. It's a tonic for bone disorders, blood disorders. When we see emaciation, weakness, feebleness, nervousness, think calcium phosphate. Because, you know, how I differentiate the calc fluor and the calc phos, I think calc fluor is more the periosteum and more the joints, where the calcium phosphate is more inside the long bones. It's making the nutrition of the bone cells. When we think bone cells, you know, bones, we're not just thinking dead rock. We're thinking the bone cells are what's making your red blood cells, your white blood cells. So when we see anemias, leukemias, when we see compromised immune system, we're going to think calcium phosphate because it helps build the cells in the body. And so we can see a lot of growing pains in children. And so this is a tissue salt of the zodiac sign Capricorn. And so I'm a Capricorn. This would have been my cell salt as a child because I had horrible teeth, crooked teeth, cavities in every tooth, lost teeth. I had just horrible dental health, and I had horrible bone health. This would have been the nutrient for me during my growing years as a child. If I was on this salt, I probably would have been 2 inches taller, had much better dental health, and much stronger bones. So this is a great bone tonic, a great blood tonic, and just a great overall tissue salt to support the health of the bones. So anytime that we see back pains, neck pains, you know, we're going to think this tissue salt. Whenever we see growing pains in children or children that, you know, aren't growing as expected with, you know, all the flat feet and the scoliosis and stuff like that, we're going to think this remedy. We may use calcium phosphate with calcium fluoride. They do overlap, but calcium phosphate is definitely a much bigger remedy, and it has more metabolic activity, where the calcium fluoride has more structural stuff. But again, we're using the intelligence of these remedies to help deal what we see on a patient as we profile them. So I love this remedy for bones, teeth, muscles, and it is an indispensable remedy to me. Now, what I forgot to mention on the calcium fluoride, it's the zodiac sign Cancer. So Cancer rules the breast and the uterus. And when we see uterine fibroids, uterine cyst, ovarian cyst, cyst in the breast, fibroids in the breast, to help dissolve the fibroids, the cysts, calcium fluoride is a beautiful remedy. And so that's its connection to cancer. So you don't have to be the zodiac sign Cancer to prescribe calcium fluoride. In fact, we have to look at these remedies that they're going to be applicable to everyone. Now, you may be more predisposed to some of the cancer disorders, or you may be, as a Capricorn, you may be more prone to a lot of the bone disorders. But we're just keeping an open mind how we can use these tissue salts with intelligence and how we can prescribe them to help build up the calcium matrix in the body. All right, so calcium phosphate. Now, another great remedy is calcium sulfate. So when you see sulfur, think sulfation. sulfation has a lot to do with the liver. So I like to see when that liver, when a lot of liver toxins are building up in us and the body can't get rid of the toxins in a nice fashion, then the liver toxins will build up and it will start to show itself in the skin. And it will show itself in the skin as eczemas, psoriasis, acne, boils, pimples, unhealthy skin, dry skin, cracked skin, all skin stuff, especially when we see a yellow discharge, because calcium sulfate has an affinity for mucous membranes. And when we see the mucous membranes that may have a yellow discharge. So in the sinus cavities, we may see a yellow discharge. That'll be more on the thicker side. It could be yellow, white, yellow, 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 brown, yellow, green. But the common theme is yellow. And so yellow is the theme of the calcium sulfate. And the discharges can be coming out of the throat, out of the lungs, can be coming out of the ears, can be coming out of the urethra, out of the vaginal canal. And so being a Scorpio, it rules down in the genitals. We may see yellow discharges coming out through the urethral or vaginal discharges. So this remedy is great for skin conditions with yellow discharges. Open infections, ulcerations, eruptions, pimples, acne, and sores. So this is a great remedy for the skin. So I like skin, I like the mucous membranes. And even when you see people that have that kind of yellow jaundice type of color, we can also prescribe this remedy. So calcium sulfate is a wonderful remedy when we're thinking blood, mucous membranes, and skin. And on an emotional level, you may see some fatigue and laziness within the patient. But again, we can see that in many types of patients that just aren't a calcium sulfate. So, we're trying to profile a patient, get as much information so we can come in with the right tissue salt as we help to heal the patient. So I like to look at calcium sulfate. It's the healer. Even when they're making casts, when they're making, when you break a bone, they're putting you on a cast. Usually the cast is made out of calcium sulfate. It's the healer. It will help heal. It works well with silica. When we see the abscesses, the thick yellow discharges, the catarrh coming out of us, think calcium sulfate. Great little remedy to have in your arsenal. Iron phosphate, Ferrum phos. This is an indispensable remedy, a standalone tissue salt. We can prescribe this to help oxygenate the body. It builds the blood. This is a great blood tonic. Now, I will use this remedy when I see children that have low-grade fevers, 99, 100, 101. I don't even think. I start the case off with iron phosphate, and we may prescribe, a wet potency in water, under the tongue, dry potency. We may have to prescribe it every hour, every 45 minutes until we see how the child is responding. And then we may have to come in with another remedy, or we may nail it right there and then, because this is help building up the oxygen in the body. And when that oxygen can't be delivered, that's going to create a lot of friction in the body. That friction in the body will result in heat, as we see with fevers and stuff like that. So this is a good first aid remedy when we see the beginning signs of the fever, the cough, the colds. Great inflammation in the body, great for kind of acute injuries. In homeopathy, arnica is a great indispensable remedy for the acute stuff, but sometimes iron phosphate can really do some of the jobs that arnica does in acute injuries. So we always have to have more tools in our toolbox to help navigate through whatever crisis we're going through. So I love this remedy when I see blood profiles where we see a lot of, iron dysregulation, low iron, high iron, ferritins, high, low, the transferrin. So whenever we see iron blood chemistry profiles that are dysregulated, we can use iron phosphate as a tonic over time to help change the lab profiles. And again, not overnight. We may have to be on this iron phosphate for a minimum of 6 months, 8 months, a year to really start changing the lab chemistry. Now, the medical doctors, when a woman's pregnant, they love to put women on iron pills. So these iron pills in these pregnant women is the #1 cause of constipation. A pregnant woman that's constipated will have a miserable pregnancy. So we never want a pregnant woman to become constipated, but those iron pills are the #1 cause of constipation. The iron pills are also another cause of prenatal jaundice. When the kid is born, they're in the, they have that yellow jaundice tint to them because of the iron toxicity building up in them, polluting their liver, causing the jaundice. And so we also will see iron pills are also notorious for causing spontaneous miscarriages. So we don't want to give iron pills. What we do want to give is iron phosphate in a 6x potency to support the pregnancy. So we can use this remedy in a multitude of ways, whether it's for anemias. When I see nosebleeds, a lot of patients of mine have nosebleeds, spontaneous nosebleeds, and for whatever reason, and I'm thinking always lachesis, phosphorus, and iron phosphate. Those are the 3 remedies that I'm always thinking of when I see nosebleeds. But this is a standalone remedy. You can use the ferrum phosphate with the other tissue salts, depending on what's going on. But I love this remedy. So just think this remedy when we have, low-grade fevers, some general inflammation in the body, some injuries, some anemias, blood stuff, and especially with menstrual bleeding, heavy menstrual bleeding, we're going to think this remedy. And again, this remedy is in the zodiac sign Pisces. Now, what's interesting, what's more paradoxical is Pisces is a water element. I always think iron as a more Mars fire element. But that's the funny thing is when everything has a negative and positive, a yin and yang. Everything has a masculine energy and a feminine energy. So the Pisces, we're adding this masculine energy into a water feminine energy. So this is how we're going to open our minds to how we can use these beautiful tissue salts. And these tissue salts can be prescribed for infants, for children, for pregnant women, for elders, our seniors. Just so many ways we can use these beautiful remedies. All right, we're going to move on to the next tissue salt. Bring my friend, I said.